India is the diabetes capital of the world. About 63 million Indians are afflicted by this disease. This number is going to rise to 80 million in 2025. Every third person in the world or in India is afflicted with diabetes every 10 seconds. And every fifth diabetic patient in the world is Indian. About 37% of population of Delhi are suffering with diabetes. 50% of this population are in pre-diabetic stage, and over 50% of this population are unaware of this. Diabetes causes heart disease, kidney disease and vision loss, and it is the major cause of limb amputation in India. So what is diabetes? Diabetes is a chronic disease in which the body is unable to use properly glucose, which is a form of sugar. Glucose backs up in the blood, thereby causing a rise in the blood glucose level. There are mainly two different types of diabetes, although there do exist some other types. Type 1, formerly called juvenile onset or insulin dependent diabetes, in which is an autoimmune type of disease in which the immune or disease fighting system of the body destroys all the insulin producing cells of the body. And type 2, which is called non-insulin dependent or adult onset diabetes, in which the body is unable to use the insulin, which is called insulin resistance, or the body doesn't produce enough insulin to use the sugar properly. Managing diabetes, I'm not going into the specifics of the management plan, but I will highlight the general principles, current principles rather. The goal of the management of diabetes is to lower the blood sugar levels and prevent the complications associated with it. Your diabetes healthcare team will focus on three areas to achieve optimum health. Number one is nutrition. When you have diabetes, whether type 1 or type 2, you need to be aware of what to eat and how much and when to eat. Having a nutrition plan will help you reduce your weight and prevent diabetes-related complications. Physical activity, number 2, is physical activity. Physical activity plays a very important role in controlling the diabetes and its complications. Having a physical activity plan or a try for moderate physical activity like brisk walking for 30 minutes a day will help reduce the major complications of diabetes like blood pressure and heart diseases. If you have type 2 diabetes, sometimes eating healthy and engaging in physical activity is not enough. Your treating doctor might give you oral medications to help control your blood glucose levels. Patients with type 1 diabetes, this means taking insulin. And sometimes patients with type 2 diabetes, they also need insulin to help them control blood glucose levels. Patients with type 1 diabetes need to take insulin, and this means they have to take it multiple injections each day or through an insulin pump, which is a small device that delivers insulin throughout the day. Everyone who has diabetes should be seen at least once in 6 months by a diabetes specialist, an endocrinologist or a diabetologist. He should be seen periodically by other members of the diabetes healthcare team, like a diabetes educator and a psychologist and a physical trainer. Everyone who has diabetes should undergo a regular eye checkup at least once a year by an ophthalmologist to look for any impending diabetes-related eye problems and treat it accordingly. Also, people with diabetes need to learn how to check their blood glucose levels. This will help them to monitor their meal plan, physical activity plan, and the medication which they are taking to know the pattern of their blood glucose levels. Last but not the least, I will highlight a few points which are very important for the successful treatment of diabetes. Number one is learn about diabetes. Each patient should try to learn more about their own disease so as to manage it well in the long term. Number two is managing stress and set achievable goals. Number four is be realistic. Each diabetic patient has got good days and bad days. So the diabetic patient shouldn't dwell on those bad days. Another point for success is ask for help. Tell friends and family members how they can help them or a diabetic patient to have a better diabetic control. And lastly is build a good healthcare team. Thank you.